All right, Isaiah, welcome to True Hope Cast. I really appreciate your time today. Thank you so much for coming on to the show. How are you and what is going well?
I'm doing well. Thank you. Thank you for having me. I'm excited to be on and share some about addictions. So, what is going well? Well, my health is well, and that's always something to be thankful for.
Absolutely. No, that's a super positive, but I appreciate it again. But let's just jump straight in. I'd love to give everyone an idea of like who you are and what it
Yeah.
is that you do, if you wouldn't mind sharing, please.
Yeah, I'm a psychiatric mental health nurse practitioner in the United States, and I work in addictions. I've been doing addiction medicine for the last 6 years. Anything from pill addiction, heroin addiction, cocaine. More recently, in the last 2 years, I've been doing alcohol and pornography addictions.
Interesting. So what kind of led you down that path from, you said, so you said that you are a psychiatric mental health nurse.
Yes.
What's the pathway to that? And did you get led into addiction because of this like some um just like personal interest? How did that kind of come about?
Yeah, so I was a emergency room nurse for years, and our hospital had a psych unit attached to it. So in the ER, we would get a lot of people wanting to detox and a lot of people with mental health crisis. So I had a lot of experience with that, and I continued my education, become a nurse practitioner, originally in family practice. And I transitioned as soon as I finished my program. I was like, I don't want to do family practice. You have to know everything about everything. I need a subspecialty. So addiction job came up. I was like, you know what? I have a lot of experience with the addicted patient, and I can relate to them. It's I find as many it has a stigma to it. So the stereotype of an addict, people have that. And one thing that one of my colleagues said one time that kind of stuck with me is we're just a couple of bad decisions away from being on the other side of this. Like it doesn't necessarily mean they're horrible people or a moral failing. So that stuck with me, and so I transitioned to addictions in 2016, and that led me down the road to get further education, being board certified in psychiatry.
Very cool. I've got a couple of questions about that, but
Yeah.
I just want us to kick off with what is an addiction? Can you just lay that down for
Yeah.
us, please?
Yeah. So I have my own my own uh, definition, and I have like the Merriam-Webster's official definition, which kind of matches. But basically, doing something that's harmful to you and not being able to consistently stop. And that's kind of the definition I use. If you want to go to the official definition, it's a compulsive, chronic, physiological or psychological need for a habit forming substance, behavior, or activity that is harmful physically, psychologically, and socially, typically having well defined withdrawal symptoms such as anxiety, irritability, or tremors. So, uh, kind of same.
Perfect. Okay, cool. So you mentioned in your story there that when you were an ER nurse, you mentioned
Mhm.
that addicts were coming in asking for help. Is that a common place for people
It
who
is.
don't know where to go? They come into the emergency room like asking for
Right.
help. That sounds
Yes.
serious.
Yes, yeah. So there's that is because addiction is pretty well overlooked in general in medicine. It's getting more and more popular, but there's hard to find places. And when somebody's ready to quit, they're ready to quit now. And a lot of times there's a wait list for 2 weeks or a month, wait list. And depending on the substance they're withdrawing from, it is an emergency. So like cocaine, heroin addicts, meth addicts, they feel like they want to die when they're withdrawing, but they're not going to. There's no medical reason that they would die. But alcohol withdrawal and and like Xanax or benzodiazepines, people have died from those withdrawals. So those are emergency room visits. You need to go to get properly withdrawn from those because there is a threat of death.
Wow. And traditionally, like, you're in the States, so let's talk about
Hmm.
the US, right?
Hmm.
Where do addicts traditionally go? Because let's say like if they're on their own and they need help,
Hmm.
they're probably in a position where they are, let's just say like not stable. They're like,
Correct.
they need help. They're frantic,
Hmm.
having to
Hmm.
ask for help in a situation. They're
Right.
probably like in and out of the actual substance
Right.
itself. So where
Yes.
traditionally do people go? Where should they go? Like, where have we kind of like
Hmm.
misled maybe those individuals on like what they can do? Is Can you tell us about
Yeah.
that?
Yeah, and that's kind of what the public's misled is. The emergency room's the place to go, and I always felt bad because the people are wanting help, but our job in the ER is to rule out emergencies. And if you're not having an emergencies, there's not a whole lot we can do. So I've always felt bad, like turning people away. There is in the U.S. There's a national there's a substance hotline. I believe 211 will also get you there where you're looking for help. There's inpatient centers, and there's so the addictions and psychological problems go hand in hand. So there's dual diagnosis centers, and that's kind of the place where I got started, where people have chronic anxiety, bipolar, schizophrenia, and they also have an addiction to whatever, and they go hand in hand. So there's in the U.S. there's different addiction facilities. Some are just for addictions, other have the dual diagnosis.
Interesting. How has addiction care changed in your experience working in medicine? Because obviously our understanding, I know you say, like, I asked you about the definition, and you've got your definition, which is probably a combination of your experience and you know, your education, and it's a big topic, and it's nothing's like solid. There's no like, we don't know as a general public, oh, my friend's got an addiction, they need to go through this pathway, you know, like it'd be great if that information was available to us so we can support people in the moment, because very much like a day, an hour, a week is a big period of time for a person who's addicted to something, right? So how has that changed through your years of being in medicine?
One thing we're really trying to change, and it has changed, is the general public's view on addiction. So typically, traditionally, it was a moral failing. Like, you're addicted to something because your morals aren't good enough. You should just stop. And since then, it's kind of accepted knowledge that this is more both a psychological and medical condition, both. So the first time, even as a nurse, the first time I saw this, I was a little skeptical. Like, alcoholism is genetic. And I was like, are you serious? Like, come on. Because I wasn't raised that way. I mean, that's the culture. And I heard it explained to me like this. You know, you and I, same height, same weight, same everything. You drink a beer, get a buzz like this. I drink a beer, get a buzz like this, a little higher. Well, who's likely to drink again? Well, the guy whose body metabolizes alcohol in a way that it releases more dopamine, and that's genetic. And that has, and sure, there are some outside factors, some trauma, abuse, that those also coincide, and mental health coincides there. But there is a genetic factor, and that has really became more accepted in the medical field.
That's really interesting. It just makes me think about that. There's obviously the genetic piece for most diseases, right? But then, like, why does that you know, what's going on in that person's life? What's their childhood experience? What's going on with them now, like, that leads them to require or really need that higher dopamine hit, right? Like, we could totally be exactly the same person, but like, what's going on for you? What's going on for me? Like, I just might need that dopamine hit, that hit of happy, that just like distance away from like what's going on in my personal circumstances. So yeah, like, it's understandable that we've been misled, and it's misunderstood, and like, we're learning all the time, and we barely know much about the brain considering how vast it is. So I think there's some understanding there in regards to how this kind of like all works, because it's so unbelievably complex. You know, we have to take genetics into account, we have to take everyone's individual circumstances into account. It's like, you can't create one protocol for that. So it's very, very tricky. It's kind of like with diets and trying to create like a meal plan or a meal pyramid or a meal plate for the whole population of a country. Like, you know, everyone's so wildly different, and you know, and their ability to get food's different. So I totally understand how it can be super, super tricky. Are there some like key things that we miss, that most people within the public misunderstand about addiction? You led on to the idea that about morals, and I think there's certainly like, there's definitely individuals that probably still think on that way, because they've not been addicted, well, they've not been consciously addicted to, let's say, like one of the more common substances or something like that. So they don't have a connection with a addicted individual. So how can we start to begin to create a little bit more understanding and, you know, maybe empathy for individuals who are addicts?
Yeah. So this one really, this statistic here really kind of changed my view on alcoholics. So you think of an alcoholic, you think of the bum on the street, right? That's the stereotypical alcoholic. Well, studies show that a person addicted to alcohol has a higher IQ than the average population. And that just blew my mind. Like that's
Interesting.
not normal. That's not what I was told to think. But and I see this all the time where I treat professionals, physicians, attorneys, and all kind of police officers, nurses, pharmacists, all these professionals who have a drinking problem. And they now why does it affect the people with higher IQs? It's really kind of to be nobody really knows exactly. Needs more studying done. But my theory is people with the higher IQs have higher jobs, like anesthesiologists carrying people's lives in their hands every day. Well, they get off of work, they just want to relax, right? Well, alcohol does that. Alcohol will relax you. Well, 6 months later, they now need 6 beers instead of 1 beer to relax. And a year from now, it's 12 beers. And just to get that relaxed, to shut their mind off, so that way they can turn off work and turn on their home life. So if you look at it that way, you're like, man, that could be me. That I'm only a few bad decisions away from being the heroin addict, because it can affect just about anybody.
Yeah, that's really interesting. You talk about that IQ piece and the high earning jobs, and I just think about the stress that comes with those jobs and the hours that come with those jobs. I mean, I don't think our biology is really designed to do, let's say, a 12-hour shift, or
Sure.
working for 16 hours for like a busy lawsuit or something. The body just is not really equipped to deal with that type of
Sure.
output without
Yeah.
having significant you know parasympathetic stress relieving activities that we would call maybe like healthy, like
Right.
movement and nutrition and meditation, things
Sure.
like that.
Yeah.
They're not usually the go-to because people have been up so high. It's very difficult to maybe think about meditating to bring that down. People certainly do it, but as you say, like, you've got those people have a short period of time where they're able to like not have to live in that stressful personality, and having a substance and using chemicals to do that. It would make sense that especially people with money would
Hmm.
be able to access beyond alcohol to be able
Right.
to obtain that. So yeah, I think we've
Hmm.
seen through like Hollywood and through movies and through TV shows how that certainly happens.
Yeah.
So that's a very interesting piece, and that's just a very simple piece of information that might allow people to connect with an alcoholic
Yeah.
a little easier.
Absolutely.
Can you tell us a little bit about the link between addiction and neurotransmitters? You mentioned dopamine.
Yeah.
So I think it's just a strong connection that people should be aware of, because we all have neurotransmitters and we
Mhm.
all have this. Let's say we all have the potential to become an addict of something, and
Absolutely.
neurotransmitters is something that we all have in common. So if you wouldn't
Yeah.
mind bringing us awareness to that, that'd be great.
Yeah. So there with addictions, dopamine is the feel good neurotransmitter. It makes you feel good. That's what, and we're supposed to have it. You hug your family members. That dopamine's released, so it's a good thing. So, but with substance use and even non-substance addictions like pornography, gambling, there's something called dopamine downregulation. So you get these high bursts of dopamine release. So we're talking about things that people are addicted to. Coffee is one of the most addicted substances in the world. 80% of the population in the world is addicted to coffee, or caffeine. I shouldn't say coffee. It includes tea and stuff. Caffeine. But I would love to see the statistics about pornography, because I have some on the U.S. Like the U.S. has approximately 91% of men have watched porn in the last month. Now, it doesn't say they're
91%.
yes.
Wow.
That doesn't necessarily mean they're addicted, but that's still kind of a lot. And how many of those are addicted, right? And then out of that, in that same month, 60% of women have watched porn. So it's not just a man's thing anymore. But so say porn, for example. You watch porn, you get a huge burst of dopamine, right? Well, your brain likes that. So it creates a new pathway to think about doing that activity again because it liked it. And then you have some Pavlovian effect. I open my computer, I watch porn. So all of a sudden, my brain says, computer porn. It makes that link. And so now you have some intrusive thoughts anytime you open your computer, intrusive thoughts about porn. So back to the dopamine downregulation, you get these high amounts of dopamine. So your brain is not wired. It's not supposed to be on dopamine all the time. So what does it do? It starts churning off the receptors for the dopamine receptors. So that way it can absorb less dopamine. And then that triggers a depressive episode. So you start to feel less happiness throughout the day, throughout normal things, hugging your family members. You're supposed to get dopamine. Well, two reasons. One, your body's used to a really high spike of dopamine. So hugging your family member, that's only a little dopamine. It's like that's nothing. And then two, your dopamine receptors get turned off. So there isn't as much dopamine being absorbed. So that's how addiction leads to depression, secondary to this dopamine downregulation.
Yeah, it's quite remarkable in regards to how when you look at it from like a biochemical standpoint, the fact that our body's so smart in regards to down regulating receptors to reduce the potentiality of having that high. And then, to reach the same levels, we're going to have to like flood it even more, right?
Sure.
So it's a really, really vicious cycle. And it's very, I just always think about the fact that we've got this like incredibly beautiful biology that the evolution of it is just so far behind our cultural evolution of access to so much stimulation, whether that's pornography or even just TV
or cell phones,
scrolling Instagram. Absolutely. And then we have all these substances, and we even have like alcohol's a really interesting topic, because alcohol is just like this very powerful chemical that we've all just agreed is okay in the society, that you can have access to every kind of anywhere. I mean, I lived in Sweden for a period of time, and there's really kind of like one store you can buy it, but then growing up in the UK, you can just buy alcohol absolutely everywhere. And it's just like, that's deemed it to kind of be okay in society. But I don't know the stats, but I'm sure it's the absolute destroyer of worlds when it comes to substances because of that availability. And it's just interesting that our cultural evolution is just so far surpassing what our body can actually deal with. And I wonder if that understanding and that piece of education could help support people to understand that what I'm going through is kind of abnormal for my biology, and maybe it's not just my fault. It's not just like my lack of morals. It's not my lack of self ability to reject these things or just stop. It's actually our biochemistry kind of inside of us, and when we can't see, hear, smell, or touch or taste things, we're kind of tough to understand. But we should definitely have some more empathy for ourselves and other individuals, because it's kind of just our biology doing what it does, this remarkable biocomputer. And then it's really I'm sure you've seen so many lives just absolutely kind of destroyed when it comes to even alcohol, something that's just so commonly available,
right, and socially acceptable.
It's quite remarkable. What are some of them? We've spoken about alcohol. We've spoken about a few things. What are some of the more common addictions that you've dealt with within the medical community, especially working in the ER, and then specializing furthermore in addiction? Like, what are the more common things that you see, and has that changed in the last couple of years with COVID, pandemics, lockdowns, and all this psychological stuff that's kind of going on for people?
So really, turn of the century, cocaine was the drug to have. There was a lot of cocaine. Mid 2000s, about 2005, 2010, heroin took over as the drug because of the ease of access. It was shipped in from Mexico and even Canada from China through Canada. And the overdose rates just skyrocketed. The city I'm in was in the top 5 cities one year. I think it was 2016 for overdoses. And the number one city was just about 2 hours away from us. They had mobile morgues, so semi trucks for morgues, because all the morgues were full, because there was just people overdosing so much. And so heroin was one of the most dangerous. So opiates are the downers, and those are the most lethal, like cocaine, meth. Those are stimulants. So when you overdose, you're less likely to die from it, less lethal overdoses. So then the pandemic. Pandemic is when pornography and alcohol addictions skyrocketed. So you're at home alone, right? So you can start drinking at noon instead of waiting until dinner to have a glass of wine, all right? And then stress with work, so you just start doing that more often. Same thing with pornography. The insidious thing about pornography is nobody needs to know. With alcohol, eventually somebody's going to find out, right? They smell it on your breath, you're acting a little goofy, slurring your words. But with pornography, nobody needs to know. and there's no outward signs of it, but it still causes that depression and causes a whole slew of other things. So yeah, the pandemic really spiked alcohol addiction and pornography addiction.
I don't know if you've got an answer for this or if you want to answer this question. I just don't know. And it's just kind of popped up for me because you were talking about like the era of cocaine and the era of heroin.
Mm-hmm.
And I just think about like, obviously there's always going to be a black market. There's going to be an illegal trade of these goods, but I don't know about like the origins of cocaine kind of back in the day and then heroin and how that can flood a population so easily without the intervention of the government and legal institutions. So I kind of wonder like who owns these, who owns the like the land in these countries of origin, because there's so much money to be made from drugs, right? And you know, I think arguably some governments, you know, I wouldn't say they're good boys and girls all of the time, you know. So do you know much about like the origin and the history of those kind of drugs flooding the population so swiftly?
Yeah, so there are some interesting books about it, and of course Netflix has a series, Pablo, talks about Pablo Escobar, the cocaine era in the 90s and early 2000s, about how he basically he was making more money than the whole country of Colombia was. So that's interesting. But then there's another book called Dreamland that kind of explains how the heroin epidemic started and how. Because traditionally heroin or morphine was made from poppy seeds, right? You would have to grow the poppy plants to produce opium, strain it down to morphine. But now it's all synthetic. Same thing with fentanyl. Fentanyl is really the killer. It's about 100 times stronger than morphine. It talks about most of this person's research was done from Mexico. These labs in Mexico was bringing it over, and they had a whole system set up where they would be distributing this, and they knew the laws, so they would only carry enough so it wouldn't be a felony. So if they were to get pulled over, got arrested, it wasn't a felony, they'll get locked up overnight, deported back to Mexico, and then another person would replace them. And they had everything all figured out. And this book is pretty neat about how it explains that. But it's an interesting concept.
Yeah, I'm going to try and learn more before I start wrapping my head around those ideas. I can't believe that like someone like Pablo Escobar can get so rich without some inside support. Do you know what I mean?
Yeah, the government wasn't completely naive. Like, come on.
Yeah, it's just that's a whole interesting dynamic. But we'll move on from that because that's, you know, I'll try and convince my wife to watch Pablo with me as some, you know, as a documentary series.
Yeah, it is good.
Right now in the US, does the government and public health services do a good job with addiction support, in your opinion?
Oh, that's a good question. It's a hard question to answer. They're doing a better job. I think that would be a fair statement.
Okay.
Because good is subjective, but it's definitely have taken some leaps and bounds. So the main medication used to, so like we said, heroin is really the most lethal drug out there. So, which is like heroin laced with fentanyl. The main medication used to treat that is Suboxone, also called buprenorphine. There was some limits on it. So if I were to want to prescribe Suboxone, I would have to go both get my DEA license, which I have, then I'll have to go to an additional class just for Suboxone, and then they'll limit me to 30 patients for the first year, 100 patients for the second year, and then 275 for every year after. So that kind of limited how many people had access to help. And of course, there's a bunch of conspiracy theories about this, but I'm not much of a conspiracy theorist. But they did away with that. And it's now becoming I can prescribe unlimited number. So just like, and it's the same thing with Percocets. If I wanted to prescribe Percocets to 1,000 people, I could. But if I wanted to prescribe the treatment for Percocet addiction, I could only treat 275.
Interesting.
But now that's changing. So I'm happy to see that people in general medicine now are more open to addictions because of, and it's sad to say that so many people have to die for people to take a look and say, hey, this is a problem. We need to learn more about it. And it's being taught more in medical schools, more continuing education. A lot of state licenses require opiate education to renew your license every couple of years. So it is getting better.
Are there any kind of like big things that you would love to see? Like if you were, say you're in charge, or things that would like really help people like right now, is there anything that kind of stands out?
Yeah. So I heard this one theory, and I'm not 100% sure on it. It's a little out there. So I don't know if you've heard of the harm reduction model. There's some places in the world that does. They basically, it's an injection zones where you can go in. Then there will be registered nurses to inject heroin for you. This reduces overdoses. It reduces HIV transmissions, all kinds of stuff. But here in the US, like I just talked about, Suboxone being so restricted. And I was talking to a colleague and I said, what if Suboxone was just over the counter? That would eliminate the street value of it. Because right now it does have a street value. That would completely eliminate the street value. If somebody wanted to quit heroin, they'd just go down to their local pharmacy and buy it. The amount a person can get high from Suboxone is next to nothing compared to heroin. It has a ceiling effect. So you can take 10 Suboxones and your body can only absorb 2 of them. That's it.
Can you just educate us a little bit better there on the heroin Suboxone situation?
Yeah. So as far as the treatment or the absorption,
all of it, to be honest. Like,
okay.
you know, somebody's on heroin and they move to this, like, you know, so, and the whole street value thing's interesting as well, and the limitations. So please.
Heroin is a full opiate agonist, meaning it lights up the entire opiate receptor, which is called the mu receptor. Now the biggest complaint I always got was, you're just trading one drug for another with Suboxone. And I was like, well, that's not true. Suboxone is a partial opiate agonist. It approximately lights up about 40% of that opiate receptor. So it covers the receptor, so you're not in withdrawal. It does help people with chronic pain issues because that's a huge trigger for drug use. And then it doesn't get you high. It doesn't release those high endorphins. And then you do become physically dependent on it because it is an opiate. So that's kind of the downside to it. But it's for people, because with people who have used heroin, the first time they get so high. The next time they get a little less high, and then a little less high. You know, you're always chasing that high. That's kind of a phrase in addictions. And eventually, after about 6 months of use, you're no longer using heroin to get high. You're using heroin just so to stay out of withdrawal. And that's where Suboxone comes in. There's other treatments. There's methadone, and then there's naltrexone. I like naltrexone a little better. I like Suboxone the best for heroin, naltrexone, and then methadone. Methadone comes with a lot of side effects, including like calcium depletion. You end up losing your teeth after long-term use. It's kind of a hard drug. But some people need it. That's great. I'm not going to judge them. But now, if Suboxone was over the counter, why does Suboxone have a street value? Well, not the distribution of heroin isn't consistent like Walmart is. So, you know, if your heroin dealer runs out of heroin, then what? Well, a lot of the times they'll have Suboxone. They'll say, hey, I'm out of heroin, but here's a Suboxone to hold you over until the new shipment comes in. So that way you're not in withdrawal.
Wow.
So, and I tell you what, working in heroin addiction, probably 80% of my patients came to me and said, I bought a street sub. That's what they call it. Suboxone on the streets, street sub. And I thought, man, if this is what recovery looks like, I think I can do it. So I'm like, legally, yes, I'm opposed to people selling Suboxone, but on a practical level, illegal Suboxone sold on the street has brought so many people to recovery that it's like, man, is it really a bad thing? And so that's why I thought, like, at least consider the idea of making, because here in the States, we have Sudafed. You know, for a stuffy nose, you have to swipe your driver's license to get Sudafed because they count how many you have because they make meth out of it, right? Why can't they do that with Suboxone? Make it so you can buy it over the counter, but you can only buy so many. So that way you're not selling them, misusing, because there's always going to be somebody misusing something. So, but for the most part, Suboxone is pretty hard to abuse. But yeah.
Wow, that was an awesome explanation. Thank you very much. And I can only just assume how complicated it is to, on a federal level, to, you know, take care of kind of all these states and take all those into consideration. Like, it must be absolutely wild. But yeah, it's it seems complex, and it seems, you know, I just always think it's very interesting to ask people like yourself who are seeing who are seeing patients and seeing people, seeing the interactions with the drugs, and also seeing what's going on in the streets as well. Without question, your opinions and experience are so unbelievably valuable in regards to how do we, you know, go further with regulations and restrictions. So that was very insightful. Thank you very much. In regards to addiction, now, in your opinion, why don't we see that addiction ourselves at first? Do you think? How do you think it goes from like casual beers after work or a glass of wine after work to being that problem? And why aren't we aware of it? Because I think we slip over into that like addiction problem
Right.
unconsciously, and then it kind of just happens, and then we're just like in that place. There's not really this space where we're contemplating whether we're going into a bad area or not.
Right. So with any addiction, you have your physical dependence and your psychological dependence, right? And at what point does it become an addiction? And why don't we realize that it's an addiction? Well, it goes back to the definition of addiction: doing something that's harmful and unable to consistently quit. Well, a person has to realize that it's harmful. And at what point do you realize that drinking three to six beers a night is harmful to you? Well, you don't really realize it because you're looking for the positive effects. And I've had a good, like I said, I do mostly alcohol and pornography addiction now. I had a good doing a podcast about pornography addiction. And he's like, what's wrong with pornography? I watch pornography. I'm like, okay, well, there are some objectively negative aspects to it, and including, like we talked about, the dopamine downregulation, decrease in sexual expectations, like increased sexual expectations, partner self-esteem is decreased. And then get this, in the United States, pornography is the third leading cause of sex trafficking. And I was like, that's like, some of the people you've watched aren't willingly there. How does that make you feel? And of course, in that podcast, we changed the subject shortly after because it's kind of uncomfortable to talk about that. So a person has to realize, and especially with pornography, like, how is that harming me? Most people don't realize it. I guess it's just for fun, right? They don't realize it's harming you until you have your spouse finds out, and your spouse's self-esteem is destroyed, and then your marriage is in trouble. Or partnership, or whatever you are. And then, or you're depressed all the time, and I can't figure out why. Well, it's this dopamine downregulation because you're watching porn 5 times a week. So it's realizing, and it goes back to, why can't we realize it? We have to realize what's harming us and how is it harming us.
Yeah, that whole pornography addiction thing is very interesting. I remember the first kind of chapters of Dopamine Nation, when she's the author, I can't remember her name, but it's an incredible book describing the experience of one of her patients. And you hear, it's an incredibly well written book. It's so descriptive, and it's just like, you can kind of understand how something as simple as just like starting to engage with pornography can just spiral to, ruining your life, your job, and it's just everything that you're thinking about constantly. It's absolutely incredible. Like that chapter of that book.
Horrible. The average age of first exposure to pornography is 11 years old.
That's so disturbing. It's ridiculous.
Mind blowing. Yes. And that's at 11-year-olds, you're not even capable to process some of these things. And not only that, it's not like when you and I were young, it was a Playboy magazine of a topless woman, right? Well, that's not the pornography that these 11-year-olds are getting into now. They have all kinds of hardcore stuff, and their brains just aren't capable, and their emotions aren't capable to process that. And that's what leads to these addictions.
Yeah, it's wild. I like listening to Jordan Peterson talk about this type of topic, because he speaks about how it's just absolutely ruining a generation of individuals, and how can you possibly expect to engage with the opposite sex in let's say a natural, normal, organic way, when this is your expectation of the physical act of love. It's very, very interesting. Also, just so destructive. It's unbelievable.
It's hard to think about and hard to talk about.
Yeah, and that's a problem, right? Because we'll just scooch that to the side and just I don't know, let society deal with it. But that's
right. Even here on this podcast, it's a little bit uncomfortable talking about, right?
Yeah, it's just disturbing in general that so many children are just being a big part of their life is being absolutely destroyed. And it can be between that time of 11 and 18, 19, 20, how much of the rest of your life is developed in that period of time, and how much it's wild. We should jump on and do a specific topic about that, because teens, with here at True Hope Canada, we're really trying to figure out how we can access a lot of teens who are using micronutrients and nutrition to support their bodies and brains to help them get through difficult times. But I think we should jump on and talk about that another time, because that's a big topic, and I'd love to just like really focus up on that. What do you think it looks like for an individual when they actually start to recognize an addiction?
Usually it's your loved ones who tells you. Pornography, it's your spouse who catches you most of the time, right? Most people don't. Also, I see a lot of religious people who secretly use pornography, and they just had enough with it, and they're like, you know what, I'm done. I can't. I need help. And with alcohol, it's typically something happens. It's your spouse is ready to leave you, or you got in trouble at work, or you're showing up late all the time, hungover. It's typically somebody who cares about you, or somebody outside who says, "Hey, this is a problem." And a lot of times it takes that much for people to get it.
Yeah, and it's really tricky, because once somebody gets caught or gets to that point where it's just impossible to hide it, they're so far gone that it can be, really difficult. The idea of recovery or not having that in their life constantly is so difficult.
Mm-hmm.
And yeah, it's interesting. So I'm a holistic nutritionist, and I've been practicing for many years, and people aren't ready to change even just their diet or where they might shop until something big happens, whether they get a diagnosis, whether they get serious pain, whether a family member like dies of something, that's that massive. And I'm sure that's got neurochemical implications as well, because that huge thing happens. That change is so difficult. And we need to maybe working with the fact that the brain has this incredible ability to create neural pathways and uncreate them as well. But we're talking about undoing physical matter, which is going to take time. It's going to take patience. It's going to take repetition and support and community to be able to change those pathways into something different. So and I just wanted to ask you about, like, what are some of the like recommended common like first steps for those people who do want to change?
Yeah. So now most people don't go directly from I have a problem to let me go to an inpatient addiction center. There's usually a couple of steps in there. Now, by all means, that's possible. It's reasonable if you want to do that. But oftentimes, it's pretty expensive. But 12 steps is a good option. Obviously, that there's nothing out there that's going to be correct for everybody. So I where I work, it's often is an alternative to AA. So a lot of pain patients I get, they're like, I don't like AA because of XYZ, whatever. That's fine. But they even have 12 steps have just about everything. They have Cocaine Anonymous, they have Overeaters Anonymous, Sex Anonymous, and it's a good first step to learn about addiction. Get on YouTube. It's a wealth of knowledge. You can listen to a bunch of different TED Talks. You can listen to Harvard professors talk about addictions, and all for free on YouTube. Right? It's an amazing experience. Obviously, you need more support than that, but I always say addiction isn't rocket science. We all know what to do. It's like losing weight. We know what to do. You eat less, you exercise, right? But it's so hard to do. With addictions, you know what to do. If you like alcohol too much, you cut off your access to alcohol, get some support around you, somebody who can ask those hard questions. How you feeling? Are you having cravings? What's going on? When was your last drink? All that stuff. Same thing with like pornography. Have somebody you can say, hey, how's that going? I know you had a problem with that. Tell me about it. And you'll get internet blockers, all that stuff. So and there is medication. Medication can help. Medication assisted treatment is really taken off in the last 10 years. So the 12-step program, I like it. I'm not going to hate on it, but it has about a 4% success rate over 3 years. 4. Yes. Okay. Medication assisted treatment has about a 50% success rate over those same 3 years. So if your life is struggling and you're about to lose your job and let you use your marriage, let's just go ahead and throw everything at it that we can. Get into therapy, get into 12 steps. Consider medication, and there's even medication for pornography addiction, and that's kind of what I've been doing for the last year. But yeah, that's some of the first steps.
That's cool. How important is that, like, community-based idea of therapy? Going to an AA meeting with other individuals that are going through have commonalities with the substance. I'm sure everyone's story is going to be different,
Right.
but how important is that community factor? Because I always think about, depressions, anxieties, addictions, people isolate themselves, they hide
Right.
away and do these things. They
Absolutely.
be depressed on
Yeah.
their own, they be anxious on their
Yeah.
own, and like, we isolate
Right.
ourselves. And the last thing we want to do is be involved with a group of people, especially people we know and love, and be
Sure.
vulnerable and open in that environment. But when we
Yeah.
go into an AA meetings, which are obviously, been going for a long time and they've got very experienced people running them, how valuable is that community aspect?
It's extremely valuable. And of course, there's not one size fit all for anything. Some people just think their thing, and that's okay. I respect that. But imagine if it were you having say, a problem with alcohol. Nobody sets out to have a problem with any substance, right? So by the time they admit it, they're kind of embarrassed, right? Disappointed in themselves. So to go to a group therapy and say, you know what, I'm not alone. There's other people out here like me who are successful in all other areas of life except this one. So I'm not a complete failure. I'm not the only one with this problem. And most people have success with group therapy for a limited time. And at some point, it's like it gets a little bit repetitive, and it's like, this is more of a trigger for me than it is helping me, and that's okay. And take it while it's helping you. Just take it and go run with it.
Yeah, I can kind of understand that 4%. I mean, I think there's a lot of value in initially going and being with a group of individuals who are going through something as you, because it just might start to make you think a little bit different in regards to just hating on yourself and beating
Yeah,
up on your own self. And then there's obviously a stage beyond that, which is like, okay, how can I start clawing myself out of there? That's going to be like different for everybody. And I'm
sure.
sure within those meetings, it's very difficult to be able to like, personally create a protocol or a program or individual
Yeah,
support or therapy for that person's specific
yeah.
needs and requirements and like wants level.
Mhm.
So yeah, I can totally understand how that can be very, very tricky. But as you say, there's other methods that people can use, and there's a wealth of knowledge online for people.
Yeah.
And it's certainly a very tricky, complex issue. But it sounds like we're doing our best um, to tackle it, I suppose. And there's always areas that we can improve on.
Sure.
Just to finish up, I'd love to ask you about fentanyl
Mhm.
and the fentanyl epidemic, just for people who don't know anything really about that, who have definitely heard of the word fentanyl.
Sure.
Can you maybe give us like a brief breakdown of like what's happening with that particular drug or medication, and then explain kind of like why that's been a big talking point over the last few years?
Yeah, so fentanyl is a medication used in medicine a lot, especially for surgeries. It's approximately 100 times stronger than morphine. So we measure it out in micrograms. I give it in the ER a lot. It's given in surgeries a lot. So people with chronic pain. So it does have its medicinal uses, and it's good. It's good at what it does. It's safe when given and properly. Now, what happened is people who make the heroin decided that they're going to start mixing fentanyl in with the heroin. And so the heroin is about 8 times stronger than morphine, and fentanyl is about 100 times stronger than morphine. So you can see how a person can overdose fairly quickly when they don't know that it's in there. And why do they put it in there? Well, fentanyl, it hits harder, so it releases more dopamine. More dopamine released, the more addicted you are. Right? I've met with a handful of people who, as teenagers, smoked marijuana, and then when they try to quit, they start going through withdrawals. Well, why? Because they laced it with fentanyl. Even marijuana nowadays are laced with fentanyl. I had one patient that said, got your story. How'd you get started on heroin? I had the best cocaine of my life, and I started getting sick. So I had to keep getting it from this person. Found out it was laced with heroin, and then the heroin starts laced with fentanyl. So that's the strength of the fentanyl is really what makes it so popular, and how cheap it is to make. So it's cheaper and stronger, but it's also more deadly.
Why is it more deadly? What's happening in the body there that kills people?
So it's just so morphine. What it does is it slows you down. It's a central nervous system depressant. It slows your heart rate down, slows your breathing down. Well, you have something that's 100 times stronger than morphine, that's going to slow your breathing down. So that's what happens, is it slows your breathing down so much that your brain starts to lack oxygen. You go to sleep, and then you don't wake up.
Wow, interesting. That was perfect. Thank you very much. There's my little hook right there. That snippet
Yeah.
was fire. Thank you so much. Um, That was awesome. I'd love to get you back onto the show to talk about teens a little bit more specifically.
Yeah.
Such a valuable topic. But how can people connect with you and learn more about your work? And you've got a podcast yourself, so please plug that and let us know about it.
Well, yeah, I was considering starting a podcast. I don't have one yet, but I was kind of considering about it. But so, like I said, I kind of specialized in pornography addiction the last year. So nox.net, no-x.net. And is where is my website. You can go to our story and you can click a 10-minute, book a 10-minute free session with myself. And we can just talk about treatments for pornography use disorder. Or if you have more questions. And we're also on a couple of socials as well. And I'll get those to you so you can put them in the tag in this podcast.
Isaiah, thank you so much for chatting with me today. That was very, very enlightening. One of the most educational episodes that I've done. So I could have you on for a few hours, I think, talking about all this stuff. So yeah, I really appreciate your time today. Thank you so much for coming on to True Hope Cast. You're welcome. Thank you. Beautiful. Well, that is it for today, ladies and gentlemen. For more information about how you can connect with Isaiah, don't hesitate to check out the description. I'll put connections there to websites, socials, etc. Don't forget to subscribe if you haven't yet. If you're listening on iTunes, please leave us a positive review or honest, whatever you think. And that's it. Thank you so much for listening. This is True Hope Podcast, the official podcast for True Hope Canada. We'll see you next week.